What is the ideal blood pressure for seniors? 99% are wrong. You need to immediately stop celebrating your blood pressure reading of 120 as a triumph. If you are over the age of 65 and your family doctor congratulates you on achieving these seemingly perfect numbers, understand this. In that very moment, you are potentially floating in a zone of life-threatening danger. The shocking and often overlooked truth is that for an older individual, this textbook ideal blood pressure value is frequently not a safeguard, but rather a direct ticket towards a loss of independence, often culminating in admission to a nursing home. A groundbreaking study published in the prestigious JTA Internal Medicine Journal, involving an extensive cohort of over 15,000 seniors, has starkly revealed a critical finding. Those who actively force their blood pressure down to this ideal value actually face an alarmingly 28% higher risk of experiencing fatal falls, alongside a significantly increased overall mortality rate. Over the course of the next few minutes, I will meticulously guide you through understanding the true sweet spot for your blood pressure, the range that genuinely protects your brain and preserves your cognitive function. And I will also introduce you to a simple 3-minute at-home test that possesses the profound potential to literally save your life. My name is Dr. Thomas Weber, and with more than 3 decades of extensive clinical experience dedicated to geriatric medicine, I witness the same heartbreaking drama unfold on a daily basis. Patients, often robust and active seniors, are routinely treated as if they were still in their prime, barely 40 years old. Their blood pressure is aggressively manipulated with powerful medications, pushed into a normative range for which their aging, stiffening blood vessels were simply never designed. The tragic consequences of this misapplication of medical standards are profound and far-reaching. Frequent nocturnal falls, devastating hip fractures that often mark the beginning of the end of independent living, and a brain that is quite literally starving, deprived of essential oxygen and nutrients because the artificially lowered pressure is no longer sufficient to effectively pump blood against gravity all the way to its uppermost reaches, the delicate tissues of the brain. Today, we definitively conclude this era of blind adherence to arbitrary numbers. I will elucidate precisely why your blood vessels, as you age, begin to function much like antiquated heating pipes in an old building, and why a moderately elevated blood pressure might, in fact, be your most crucial insurance policy against the insidious progression of dementia and the debilitating onset of kidney failure. Before we delve into the revelation of the new golden table outlining optimal blood pressure values, I urge you to reflect. How old are you, precisely? And have you ever, upon rising swiftly from a chair, experienced that fleeting moment of vision dimming, a brief blackout, or a sensation of lightheadedness? Please share your exact age and the word dizziness in the comments section below. This specific piece of information is absolutely critical, as a 65-year-old individual necessitates an entirely different physiological strategy and medical approach compared to an 85-year-old. To truly grasp the perplexing paradox of why a seemingly optimal blood pressure reading of 120/80 can, in fact, pose a grave danger for an 80-year-old, we must first liberate ourselves from the entrenched yet fundamentally flawed notion that our human body is an unyielding, static structure. Throughout my extensive 3-decade career in medicine, I have consistently found it helpful to employ a vivid analogy that resonates deeply and is easily understood by many, particularly those familiar with older European architecture, the intricate heating system within a robust, venerable old building. Envision, if you will, a grand residence constructed 8 decades ago. Its original copper pipes, meticulously installed so many years ago, have, over the relentless march of decades, inevitably become somewhat more rigid, less pliable than their youthful counterparts. Furthermore, the internal walls of these pipes have gradually accumulated deposits, a natural consequence of continuous use, much like limescale building up in a kettle. Now, imagine it's the dead of winter, and your desire is for the warm, life-giving water to circulate effectively, reaching the radiators on the third floor, directly beneath the roof. What then is your instinctive, logical course of action? Precisely, you must increase the pump pressure at the boiler situated in the basement, setting it notably higher than you would in a contemporary new building equipped with modern, flexible plastic pipes. This precise mechanical analogy mirrors the profound physiological transformations occurring within your own arteries. This pervasive, age-related process is medically termed arteriosclerosis. It is not an anomaly or a disease in its early stages, but rather a completely natural and unavoidable accompanying phenomenon of the human maturation process, an integral part of the very fabric of aging. Your blood vessels, once supple and resilient, gradually surrender their youthful elasticity. They progressively stiffen, akin to an old garden. Hose left exposed to the relentless glare of the sun for an extended period, losing its pliability and becoming brittle. When your heart, with its rhythmic contractions, endeavors to pump vital blood into these increasingly rigid conduits, these aged vessels are no longer capable of gently cushioning and absorbing the powerful pressure wave generated by each heartbeat, a feat they performed effortlessly when you were a vibrant 20-year-old. Yet your brain and your kidneys, metaphorically speaking, the uppermost stories of your body's intricate architectural design, are profoundly dependent upon a constant, uninterrupted, and adequate blood flow. In medical parlance, we refer to this critical phenomenon as perfusion. If we now, through the application of potent chemical interventions, specifically medications, artificially depress the pressure at the basement level, your heart, down to an arbitrary target of 120, the inherent pumping force often becomes woefully inadequate. It simply lacks the requisite power to surmount the accumulated resistance of these stiffened vessels and to propel the blood against the persistent pull of gravity all the way up to your brain. The devastating consequence is profound. Your brain begins to literally starve while you are still alive. The persistent mental fog, the frustrating lapses in memory, and the debilitating leaden fatigue that many seniors experience are, strikingly, often not merely inevitable signs of advancing age, but rather unambiguous indicators of an unnaturally and dangerously low blood pressure. This critical state often leads to reduced cognitive function, slower processing speeds, and a diminished capacity for daily activities, directly impacting quality of life and independence. Consider another crucial aspect of the body's intricate regulatory system, often overlooked in the context of aging, the phenomena of the sleeping guardians and the subsequent failure of the baroreceptors. Why do so many seniors experience sudden collapses or dizzy spells when they attempt to rise quickly, especially during the nighttime hours? This is where a second, equally vital biological phenomenon comes into play: the sophisticated network of baroreceptors. These are minute, yet incredibly potent, pressure sensors strategically embedded within the walls of your carotid arteries, located in your neck and within the elegant arch of your aorta, the body's main artery. Their primary and indispensable function is to instantaneously adjust your blood pressure within mere milliseconds the moment you alter your body's position. When a young individual whose physiological systems are operating at peak efficiency stands up, these vigilant guardians immediately register the subtle, transient drop in blood pressure within the head region. Without delay, they dispatch a lightning-fast signal to the brain's regulatory centers. In response, the heart accelerates its beat, pumping more vigorously, while the blood vessels in the lower extremities constrict, effectively minimizing the pooling of blood in the legs. The net effect is a remarkable stabilization of blood pressure, preventing any significant drop and maintaining a steady flow to the brain. However, as the aging process progresses, these vital baroreceptors, much like weary sentinels, become fatigued and their responsiveness significantly diminishes. They react with a pronounced sluggishness and inefficiency. If your blood pressure has already been aggressively suppressed to a value of 120 through pharmacological means, and you then suddenly rise, the entire delicate regulatory system system can catastrophically fail. The blood pressure plummets rapidly, often within mere seconds, to dangerously low levels, frequently dropping to 90 or even 80 mmHg. This specific condition is medically termed orthostatic hypotension. Your brain, for a critical, albeit brief, moment, is deprived of essential oxygen. The world around you begins to spin uncontrollably. Your knees suddenly weaken, becoming unable to support your weight, and before you can consciously react or even brace yourself, you find yourself on the floor. In countries like Germany, a staggering nearly 1/3 of these falls result in a devastating hip fracture. And tragically, we are acutely aware that a hip fracture in an individual over the age of 80 is, all too often, the grim harbinger of the end of their cherished domestic independence, leading to prolonged hospitalization, complex rehabilitation, and frequently permanent residency in a long-term care facility. I must interject here, momentarily pausing the flow of information, because this particular topic resonates deeply with me and lies at the very core of my professional concern. I witness far too many patients in my practice who proudly recount their perfect 120 blood pressure readings, yet simultaneously confide in me that they constantly feel weak, perpetually fatigued, and harbor a profound fear of venturing out alone for a simple walk. This disconnect between a seemingly ideal number and lived experience is precisely what we must address. I pose a direct question to you. In the past few weeks, have you noticed any sensation of dizziness or lightheadedness when you rise from a comfortable chair, or perhaps during those urgent nocturnal trips to the bathroom? If you are intimately familiar with this disorienting sensation, please signify by typing the number 1 into the comments section. Conversely, if you feel entirely comfortable and well-adjusted with your current blood pressure readings, experiencing no such episodes of lightheadedness or dizziness, please type the number 2. And one more crucial inquiry: how many of you have ever had a physician suggest that it is perfectly acceptable to allow your blood pressure to run a bit higher, perhaps tolerating values around 145 mmHg? Please share your experiences. Your insights are invaluable. I am genuinely eager to ascertain how many truly progressive and enlightened general practitioners are already embracing this nuanced, age-appropriate approach to blood pressure management. Now let us turn our attention to the undeniable veracity of the numbers, particularly as illuminated by groundbreaking research. The medical community traditionally structures its practice and recommendations around what are known as guidelines. However, a critical question arises: who precisely crafts these influential guidelines? All too often, they are formulated by expert commissions whose underlying studies have been predominantly conducted on cohorts of much younger patients, typically those in their 50s. For a considerable period, a pervasive and deeply ingrained assumption dominated medical thought. What proves beneficial for a 50-year-old must inherently be perfectly suitable, even optimal, for an 85-year-old. This, as contemporary research unequivocally demonstrates, constitutes a fatal and profoundly dangerous fallacy in reasoning. Not long ago, the highly respected peer-reviewed journal JMA Internal Medicine published a landmark study that reverberated through the world of geriatric medicine with the force of a bombshell. This comprehensive investigation meticulously tracked over 15,000 senior individuals over an extensive period of 5 years. The resultant findings dramatically contradict virtually everything that has been commonly advocated and told to patients regarding ideal blood pressure values for the elderly. The researchers unequivocally established that the cohort of participants maintaining a supposedly perfect systolic blood pressure below 120 mmHg actually exhibited the most detrimental outcomes. This group not only bore the highest statistical risk for severe, life-altering falls, but they also suffered significantly more frequently from acute kidney failure. The critical question here is, why? The answer lies in the fundamental physiology of the kidney, which is, by its very nature, a high-pressure organ. It absolutely requires a certain minimum filtration pressure to effectively press metabolic waste products and toxins out of your blood, performing its vital cleansing function. When this requisite pressure is artificially diminished, the kidney's intricate filtration mechanisms struggle, falter, and eventually cease to function optimally. As a direct consequence, the blood becomes increasingly acidified, accumulating dangerous levels of toxins, and the entire organism is systematically poisoned. In stark contrast, the group that experienced the longest lifespans recorded the fewest hospital admissions for various ailments, and crucially, remained the most mentally sharp and cognitively fit, was precisely the group whose blood pressure consistently ranged between 130 and 145 mmHg systolic. Within this identified sweet spot, the pressure is sufficiently elevated to effectively overcome the increased resistance of stiffened, aging blood vessels, thereby ensuring adequate perfusion to vital organs, but simultaneously low enough to avoid unduly burdening and overtaxing the heart muscle. This, unequivocally, represents the biological reality and the optimal physiological state for the aging human being. Understanding this divergence from conventional guidelines is pivotal for ensuring truly patient-centered care for our elderly population. Given this critical information, how can you, an individual senior, ascertain whether your current prescribed medications are inadvertently pushing you into this perilous death zone of 120-80 mmHg? You do not have to endure the uncertainty or passively await your next scheduled doctor's appointment. I am now going to walk you through the essential steps of the SHI HENG test, a simple yet profoundly insightful diagnostic procedure that you can readily perform in the comfort and safety of your own home. All you require for this crucial self-assessment is a reliable, accurately calibrated blood pressure monitoring device and approximately 15 dedicated minutes of your time. Step 1. The rest phase. Begin by lying flat and comfortably on your bed or a sofa. Ensure that the television is switched off and that you are in an environment conducive to relaxation. Rest in absolute stillness for precisely 5 minutes. This period of undisturbed repose is paramount, as it allows us to establish your baseline blood pressure value, free from the influence of any transient physical or emotional stress. Step 2. The lying measurement. While you are still horizontally reclined in the resting position, proceed to measure your blood pressure. Carefully note both values, the upper or systolic reading and the lower or diastolic reading. For illustrative purposes, let's assume your measurement registers 138/82. This will serve as your crucial reference point. Step 3. The standing measurement, stress measurement. Now, without hesitation, rise from your lying position with a swift but controlled movement. It is important not to rush frantically, but rather to execute a deliberate and steady ascent to a standing posture. Remain calmly upright and immediately, without any delay, measure your blood pressure once more, this time on your arm while you are standing. Do not wait for even a single minute. It is absolutely imperative that we capture the blood pressure value recorded within the first 60 seconds of you standing. This immediate post-standing measurement is key to revealing your body's instantaneous circulatory response. The evaluation. Identifying the red flag. In a physiologically robust and healthy cardiovascular system, the systolic blood pressure value upon standing should either remain virtually unchanged from the lying measurement or experience only a minimal, insignificant decrease. Concurrently, a healthy system will typically show a slight compensatory increase in pulse rate. However, if your systolic blood pressure value dramatically plummets by more than 20 points, for instance, if it drops from 138 mmHg while lying down to a concerning 110 mmHg or lower while standing, then this constitutes a clear and unequivocal red flag. Such a significant drop indicates that you are likely suffering from a massive orthostatic dysregulation. This critical finding strongly suggests that your current blood pressure medications are, in fact, excessively potent for your specific current biological state and physiological needs. In this very moment, you are at an acute and elevated risk of experiencing a dangerous fall. Irrespective of how reassuringly normal your blood pressure reading may have appeared while you were sitting comfortably in your doctor's office, this disparity underscores the vital importance of the SHI HENG test in uncovering hidden risks. To address this crucial gap in conventional recommendations, allow me to introduce the new Golden Table by Dr. Weber. It is time to entirely disregard the outdated one-size-fits-all blood pressure values that have long been indiscriminately applied across all age groups. What follows are the precisely targeted ranges that we, in the vanguard of modern geriatrics, now actively strive for to ensure not only your continued vitality, but more importantly, your sustained safety and independence. 1. For the young seniors, individuals aged 65 to 74 years, if you are generally fit, active, and maintain a good level of physical health, an ideal systolic blood pressure range falls between 130 and 140 mmHg. This specific target range is meticulously designed to provide adequate protection for your heart, preventing undue strain, while simultaneously allowing for sufficient circulatory reserve to consistently supply your brain with the vital oxygen and nutrients it requires for optimal function. It represents a balanced approach, avoiding both under and over treatment. 2. For the middle-aged seniors, individuals aged 75 to 84 years. In this demographic, the physiological sweet spot for blood pressure shifts noticeably higher, reflecting the natural changes in arterial elasticity and vascular resistance that occur with advancing age. Our aim here is to achieve and maintain systolic values ranging between 135 and 145 mmHg. Extensive and unequivocal studies conclusively demonstrate that individuals in this age bracket who sustain their blood pressure within these elevated parameters exhibit the highest documented life expectancy and enjoy superior overall health outcomes. This range ensures robust perfusion without excessive cardiac workload. 3. For the very elderly or frail patients, individuals over 85 years of age. For this most vulnerable segment of our senior population, the overarching priority unequivocally shifts from the mere cosmetic adherence to arbitrary numbers to the paramount importance of fall prevention. In these cases, a blood pressure reading between 140 and 150 mmHg systolic is frequently not only deemed absolutely acceptable, but is, in fact, highly desirable and actively sought after. This higher range is critical for ensuring consistent and adequate cerebral blood flow, thereby preventing the dangerous episodes of fainting, dizziness, and subsequent falls that can so catastrophically impact the health and independence of the very old and frail. It is a pragmatic approach prioritizing real-world safety over abstract numerical ideals. A crucial, yet often overlooked component of your blood pressure reading is the lower value, or diastole. Many medical practitioners tend to focus almost exclusively on the upper systolic value, dismissing the diastolic reading as less significant, especially in older adults. However, for those of us over the age of 60, the diastolic pressure is of paramount, indeed life-sustaining, importance. It should ideally never descend below 65 mmHg, with an optimal range typically situated between 70 and 85 mmHg. The profound reason for this lies in the very mechanics of cardiac function. It is during the diastolic phase, the relaxation phase of the heart, that your critical coronary arteries, which supply blood to the heart, muscle itself, are perfused. If the pressure within these arteries is allowed to drop too low during this crucial relaxation period, your heart muscle simply does not receive an adequate supply of oxygen. An unnaturally low diastolic value, often aggressively reduced by medications, is a frequent yet tragically overlooked and underdiagnosed root cause of heart weakness, cardiac insufficiency in the elderly. This highlights the critical need for a holistic assessment of both systolic and diastolic pressures, tailored specifically to the unique physiology of the aging heart. Now, I understand what many of you might be thinking. Dr. Weber, my long-standing family doctor, who I deeply trust, has been steadfast in his opinion for 2 decades that 120 mmHg is the definitive target. How am I supposed to articulate this new perspective to him without being perceived as a difficult or challenging patient? It is true that in many cultures, including Germany, there exists a deep-seated reverence for the medical professional, often perceived as an almost infallible demigod in white. However, it is absolutely vital to remember that we are discussing nothing less than your own personal well-being, your delicate hip joint, your precious memory, and your fundamental quality of life. Therefore, empowering yourself with knowledge and a clear communication strategy is paramount. Here is your actionable battle plan for your very next conversation with your physician. 1. Bring concrete data with you. Do not simply recount your experiences, present tangible evidence. Show your doctor your meticulously documented SHI HENG protocol, specifically the comparative measurements taken while lying down versus those taken while standing. A medical professional, regardless of their prior convictions, cannot simply disregard factual, patient-specific data. State clearly and assertively, "Doctor, I have observed a massive and concerning drop in my blood pressure when I stand up, and I frequently experience alarming blackouts. I am genuinely worried about my elevated risk of falling, and I believe my current medication regimen may be contributing to this." 2. Emphasize the principle of individualization. Frame your concerns using informed language that reflects modern medical understanding. Utilize a phrase such as this: "I have taken the initiative to educate myself about the latest contemporary studies concerning the individualization of blood pressure target values, specifically for elderly patients. Given what I perceive as mild arterial stiffness in my own circulatory system, I genuinely feel significantly safer, more alert, and more functional with a blood pressure value hovering around 140 mm Merc. This demonstrates proactive engagement with your health and an understanding of age-specific physiological nuances." 3. Demand an elevated quality of life. Articulate your priorities clearly, focusing on functional outcomes rather than abstract numbers. Explain passionately that you would unequivocally prefer to be safely and stably on your feet, fully mobile and independent, with a blood pressure of 145 mm rather than remaining constantly fatigued, dizzy, and confined to a chair with a perfect 120 mm reading. Emphasize that genuinely good medicine fundamentally treats the unique patient with all their individual circumstances and aspirations, not merely the statistical data points on a laboratory report. Be courageous, be steadfast in advocating for yourself. This is an issue of your fundamental autonomy and your right to a fulfilling quality of life. Your voice in your healthcare decisions is not just important, it is absolutely essential. My esteemed ladies and gentlemen, today we have courageously breached a long-standing medical taboo. We have collectively learned that in the complex realm of medicine, particularly for the elderly, what is often mistakenly deemed perfect can, in fact, prove to be the insidious enemy of what is truly good and beneficial. Let us firmly anchor these critical insights in our minds. 1. The 120/80 mmHg value. This seemingly ideal reading is fundamentally a target range tailored for individuals in their 40s, whose cardiovascular systems possess youthful elasticity and robust regulatory mechanisms. It is unequivocally not an appropriate or safe target for individuals who have accumulated decades of invaluable life experience and whose blood vessels have naturally matured and stiffened. 2. A moderately elevated blood pressure between 130 and 145 mmHg systolic. This range is not a sign of illness, but rather your formidable protective shield. It represents your best biological defense against the debilitating progression of kidney failure, which can profoundly impact quality of life, and against the insidious and memory-robbing onset of dementia, preserving your cognitive faculties. This is where your body, given its age, thrives optimally. 3. The SHI HENG test. This simple yet powerful at-home assessment is your invaluable insurance policy against the potentially fatal fall. By proactively identifying orthostatic dysregulation, you empower yourself to take corrective actions, significantly reducing your risk of injury and preserving your cherished independence. If you have assimilated and genuinely understood these vital pieces of knowledge today, then you have already taken the most crucial first step in actively defending your vitality and safeguarding your independence well into your advanced years. Do not permit yourself to be intimidated or swayed by abstract abstract, generalized, normative values that fail to account for the unique physiology of aging. Instead, cultivate a profound listening connection with your own body, paying heed not solely to the numerical display on your blood pressure monitor, but to the qualitative signals your body is sending you. I am deeply committed to assisting you in integrating these life-changing insights into your daily routine and proactive health management. To this end, I have meticulously prepared a comprehensive blood pressure target table specifically designed for seniors, which also includes a practical template for you to meticulously document your personal Shillong test results. You can effortlessly download this invaluable document completely free of charge by simply clicking on the link provided in the description section below this video. I strongly encourage you to take it with you to your very next doctor's appointment, facilitating an informed and productive dialogue. Furthermore, I urge you to subscribe to this channel without delay, ensuring that you never miss another piece of this life-preserving information. Please also consider sharing this video widely with your friends, within your senior groups, or via WhatsApp with your siblings and other family members. Knowledge, especially this kind of tailored, age-appropriate medical insight, truly saves lives. And in this particular instance, it quite literally saves your precious independence and quality of life. I am Dr. Thomas Weber. Remain critically engaged, stand steadfast in advocating for your health, and above all, remain vibrantly healthy. I look forward to connecting with you in our next video. To conclude, I must impart one final and critically important reminder for your journey towards better health. The information meticulously presented within this video is intended solely for the purpose of general education and enlightenment. It is not under any circumstances to be construed or utilized as a substitute for professional medical advice, a formal diagnosis, or an individualized treatment plan. Every human being is a unique and complex individual with distinct physiological responses, medical histories, and health requirements. Therefore, you must never, under any circumstances, independently alter, reduce, or completely discontinue your prescribed blood pressure medications without the explicit and direct consultation and approval of your treating physician. Any and all adjustments to your therapeutic regimen must be undertaken strictly in collaborative consultation with your healthcare provider. Furthermore, while the Shillong test is a valuable tool, its performance is undertaken at your own risk. Please ensure you take appropriate safety precautions when rising from a lying position, especially if you anticipate or experience dizziness or lightheadedness. Never act solely based on information you have heard or seen in this video without professional medical guidance. Your health and safety are paramount.